This is the doctor from the Academy. Welcome to our channel where medical topics are made easy. The series of videos here in the Academy are designed to give you an overview of different medical subjects so that you can have a better understanding of how the body works when it's sick or injured. With that said, let's begin. In this video, we're going to talk about CPR for beginners. We're going to cover everything you need to know in under 5 minutes. Let's get into it. So, what is CPR? CPR stands for cardio meaning heart, pulmonary meaning lungs, and resuscitation meaning to revive. So, put together, CPR is used when someone's heart stops beating and their lungs stop working. The goal of CPR is to manually keep blood flowing to the person's vital organs, such as the brain, and the heart itself, so that if their heart can be restarted or if their breathing can be restored, they can survive without any long-term damage. Who needs CPR? Anyone whose heart stops beating needs CPR. That could be from drowning, a heart attack, drug overdose, electric shock, choking, and many other reasons. Children and infants can also have their hearts stop beating. But typically this happens from respiratory issues like breathing and vomit or aspirating a foreign object. What are the 3 steps of CPR? The 3 steps of CPR are chest compressions, rescue breaths, and defibrillation. Chest compressions are used to circulate blood throughout the body. Rescue breaths are used to oxygenate the patient's blood, and defibrillation is used to stop an erratic heart rhythm called fibrillation, so that the heart can hopefully be restarted at a normal rate. Defibrillators are only available in certain situations. Most often, chest compressions and rescue breaths are all that will be available to you during an emergency situation. Let's start with chest compressions. How do you perform chest compressions? To perform chest compressions, place the heel of one hand on the center of the chest, then place your other hand on top of the first. Keep your arms straight with your elbows locked. Press down hard and fast, aiming for a compression depth of at least 2 inches and a rate of 100 to 120 compressions per minute. It's important not to overcompress, which can cause broken ribs, and not to undercompress, which won't move blood. Aim for that sweet spot in the middle. How deep should chest compressions be? For adults, children, and healthcare providers performing CPR, chest compressions should be at least 2 inches deep. For laypersons performing CPR on an adult, the depth is not as important as the rate of compressions. If you're unsure if you're compressing hard enough, err on the side of caution and compress harder. How fast should chest compressions be performed? The rate of chest compressions should be between 100 and 120 compressions per minute. You can speed up or slow down your compressions to match the rate that's comfortable for you, as long as you stay within that range. Try counting to 15 and performing a full set of compressions in that time. Then count back to 15 and repeat. How long should compressions be continued? Compressions should be continued until help arrives. That could be the fire department, your local emergency medical services, or even a physician who's close by. It could also be until the person's heart restarts on its own, they start breathing normally, or they start moving. What is the proper hand placement for chest compressions? Place the heel of your first hand on the center of the chest, then place your other hand on top of the first, with both hands positioned one on top of the other in the center of the chest. If you're performing CPR on a child, you may use one hand for compressions. What if I break a rib while performing CPR? While it's very unlikely that you would break a rib during CPR, it's possible. Typically, ribs are more likely to fracture during the rescue breaths portion of CPR rather than during chest compressions. However, if a rib does fracture during CPR, don't stop compressing the chest. Continue compressions until help arrives. Let's move on to rescue breaths. How do you perform rescue breaths? After chest compressions and before defibrillation, if available, rescue breaths are performed. Here's how to do them. Tilt the person's head back and lift their chin to open the airway. Pinch the nose closed and create a seal over the person's mouth with yours. Breathe once, then look and listen to see if the person's breathing normally again. If not, continue rescue breaths at a rate of 1 breath every 6 to 8 seconds. Each breath should last about 1 second. How long should rescue breaths be? Each breath should be about 1 second in length. After each breath, look and listen to see if the person starts breathing normally. If they do, stop rescue breaths. If they don't, continue rescue breaths at a rate of 1 breath every 6 to 8 seconds. How do you know if a breath is effective? You won't always be able to feel or hear an effective breath, but it's worth trying. Try to relax and allow the breath to flow out of you and into the person. If the chest rises with each breath, that's a good sign. The breath was effective. Should I perform a head tilt and jaw thrust on an infant? No. For infants younger than 1 year old, you should not perform a head tilt and jaw thrust. Instead, you should lay the infant on their back and perform chest compressions only until help arrives. What if the person spits up after I attempt a rescue breath? If the person spits up after a rescue breath, just wipe it away and continue with chest compressions. Let's move on to defibrillation. When should defibrillation be used? Defibrillation should be used as soon as possible after cardiac arrest. It can help restore a normal heart rhythm in someone whose heart has stopped beating due to a problem with their heart rhythm. How does a defibrillator work? A defibrillator delivers an electric shock to the heart through pads placed on the chest. This shock is not something you want to experience, but it can be life-saving for someone who is unresponsive and not breathing. Do I need to be certified in CPR to use a defibrillator? In most places, no. Many automated external defibrillators, or AEDs, are available for public use. These defibrillators will talk you through the steps of using them and won't deliver a shock unless they detect a shockable rhythm. If a defibrillator isn't available, can I perform a manual defibrillating rhythm? No! Manual defibrillation requires electrical equipment and specialized training, and isn't something that can be learned in this video. When can CPR be stopped? CPR can be stopped when the person shows signs of life, like breathing or moving. It can also be stopped when a physician determines that it's no longer needed. In most cases, physicians will try other methods of reviving a patient before restarting CPR. Also, CPR can be stopped when an advanced airway is placed. An advanced airway is something like a breathing tube that allows the patient to breathe mechanically without the need for rescue breaths. Finally, CPR can be stopped when the person is transferred to a hospital and a physician takes over care. Is there anything else I need to know about CPR? Yes, there's a lot more to learn about CPR, and we encourage you to seek out a class near you so that you can learn these life-saving skills in person. A class will also give you the opportunity to practice on a mannequin, allowing you to build confidence in your ability to perform CPR in an emergency situation. You'll also learn how to use an AED, which can be life-saving for someone whose heart has stopped beating. You'll also learn how to treat different age groups, like infants, children, and the elderly. We hope this video helped give you a good overview of the basics of CPR. Remember, this video cannot take the place of a CPR class. We highly encourage you to seek out a class near you so that you can learn these life-saving skills. Thank you for watching. If you found value in this video, please hit the like button below. We'd really appreciate it. As always, you can find all of the notes and references for this video in the description below. Don't forget to subscribe